The organization's name is Indian Creek Foundation. We were founded in 1975. In 1975, a family who had a baby that was just born with Down syndrome wondered who was going to take care of our son when we're no longer here. So they got together with other families, and in our area there are a lot of Mennonite families, and so with the support of the Mennonite Church, Indian Creek Foundation was started in 1975. We have 20 group homes. We have a vocational training program. We have a day program. We support people who live on their own in apartments. We support people who live in home with mom and dad. And then we have a behavioral health component, which is our newest part, and that serves people who have both an intellectual disability and a mental health disorder, with counseling and psychiatric services. In addition, we serve children in an after-school program for children with autism. We also have a summer camp for children with autism. And our outpatient mental health center serves both adults with a dual diagnosis of intellectual disabilities and a mental health disorder. And now, just this past year, we've added the children's program, again, serving children with autism or children with an intellectual disability and a mental health disorder. Our vocational programs are set up to kind of meet people where they are. So we have some folks who are best suited in what we call our workshop program. In the workshop program, we do bulk mailing, we do some light assembly, we do some packaging, a variety of jobs for our local businesses here in the Souderton area. If they're ready for a little more independence, then they go to the transitional employment program. That program consists of 6 individuals, 6 of our clients, and a supervisor in a van, and they go to different businesses that contract with them to do office cleaning or an apartment building to do general cleaning. They've done some gardening work, nothing with power equipment, but they've planted seedlings at a local florist, things like that. We like that because it's a step between the workshop and full employment on their own. And that's the final step. And we call that supported employment. And with supported employment, we will go help teach the individual how to interview for a job, get them ready for that, how to dress. Then we go, and when they get a job, we shadow them, and we'll have our job coach that's with them for the first 2 weeks of the job, helping the client to meet the other coworkers, to meet the manager, to learn the job. After those 2 weeks, though, the job manager fades away, and the person holds the job on their own. The story is one of our clients, BJ. Now, BJ is passed now, but she had a job at Pizza Hut. And Pizza Hut has a national initiative to hire folks with a developmental disability, so it's really great. And she was doing wonderful. We had taught her, our job coach taught her the job, she had friends, and BJ was a wonderful, outgoing person and made lots of friends. But at Pizza Hut, the manager changed, and I think this happens from time to time. So a new manager came in, and unfortunately he didn't understand anything about developmental disabilities, and he felt that there's just no way someone with developmental disabilities could do this job, so he wanted to fire her. So our job coach came in and tried to smooth things over, but he wasn't listening to that. And so they terminated her. So BJ didn't have a job. Our director of the program at the time wrote a letter to Pizza Hut, national, and said, here's the situation. Pizza Hut National came down and told the manager that he needed to rehire BJ. So we won for us. And then before too long, he was transferred to another store. So hats off to Pizza Hut for standing behind your values. That's another one of my favorite stories to tell. In the next year, we have a number of programs on the burner that we would really like to see develop. In this field, you can't just do workshops and group homes and expect to survive. Those are the old models. They're still needed. Lots of people, we get a lot of referrals for those programs, and I want to keep those going and continue to improve those. But you've got to grow, I believe, the cutting edge, the newer things. That's why we added the outpatient mental health center several years ago. That's why we started to do services with children with autism. So on our drawing board, if it all can work, is we would like to, following along the model of our outpatient center, do a federally qualified health center for folks with an intellectual disability. So here we're trying to marry primary health needs with a nurse-managed center with the developmental disabilities. Again, our folks, when they go to a doctor, we have to do a lot of desensitivize. You may have to make them more comfortable in that environment. They're nervous, they're scared, and they're not necessarily geared for folks with developmental disabilities. It works, they do it, but it's not perfect. We think we can do a better job there with our nurse practitioners. We already have a nursing department. We're doing some of these things for our existing clients in the residential programs. But we would like to do it for not only those, but people in the community. A lot of folks with intellectual disabilities live at home with mom and dad. There's not funding for everybody. There's a waiting list in Pennsylvania right now. It's somewhere around 15,000 people at different levels of need. Some need it tonight, others need it in a few years from now. So there's a lot of people who need support, and we don't believe our mission calls us just to serve those who the state authorizes for service. We want to be, our mission is more broader than that. It's to all folks with intellectual disabilities. Yeah, to my peers, fellow execs, working for a nonprofit, working for folks with developmental disabilities, again, hats off to you for your hard work. It's not easy. This is not necessarily the field where you're going to get rich. We all know that if you're, and we're the top of the food chain, and still, it's tough. There's a lot of challenges day in and day out, and my message to you is rely on the good people you have hired. Hire good people, get out of their way, let them do their job, and because it's really a team approach. It's too much for any one individual to handle and be the answer for everything. Use the team approach to your advantage, and I think it'll help you be successful.